Still morning? Yeah, good morning. First, I want to thank everybody here for coming. Just looking at this room and just talking to a few of the patients that I have in this room just really humbles me, because it just, I've been in practice now for almost 18 years, and you just don't realize the magnitude that that you have on patients' lives and the volume of patients that you take care of through the years. And when I see people around the room and they come up to me and say hi, I'm like, wow. And I was mentioning to one of the patients, I'm horrible with names, but I'll never forget your face. So I moved here in 2005, straight out of Fellowship. I did my trauma fellowship at Tampa General Hospital. And when you do a trauma fellowship, you're taking care of a lot of severely injured patients. So I was really good at taking care of fractures. When Dr. Sherfy and I did our training together in Michigan, we did a lot of joint replacements. So really for a whole year during my fellowship, I didn't do any joint replacements. And then it came time to look for a job, and I wanted to move to California at the time. And I interviewed at a bunch of different places, UCLA, Cedars, all those places. But I knew that if I were to go to one of those facilities, I would only be doing trauma. And I loved orthopedics so much, and I love taking care of patients so much, and I wanted to do everything that orthopedics has to offer. So when this job opportunity came, and I told some of my friends that I'm going to be working in the Antelope Valley, they're like, dude, you want to go work in an armpit of LA County? And let me tell you, this is the best decision I've ever made in my life. When I moved up here, yeah, Dr. Nasser and I, we were literally in an office, it was like 1,000 square feet, like, what are we doing here? And slowly but surely, we grew together, and Dr. Nasser, Joseph said it perfectly, we complement each other. So he does the rehab, the pain management, I inflict pain, he takes care of the pain. And it just worked like a symbiotic relationship. And then from that, for a lot of the patients in this room knew that we moved to the building next to AV Hospital, and now the building that we're in right now, we've been there for like 12 years. So we've grown. And Joseph Hurley nailed it on the head. I wanted to build a group here. I wanted to bring surgeons here to this valley that would be able to help me take care of patients, and that's why I brought Dr. Sherfy. Dr. Sherfy and I go back over 20 years. We were literally, the first day as a doctor, he and I are literally sitting in a room, and the nurse will call us, Dr. Antebi, I need an order for Tylenol. And I'm like, Tylenol? What's the dosage on that? We didn't know anything. And he and I, we basically grew up together as surgeons, and he went to Washington to practice for about 10 years, and we stayed in touch for the years, and I brought him here. He's an excellent surgeon. And we recently acquired Dr. Owashi a year and a half ago, who's newly trained out of Scripps. Again, and we hope to continue to bring more quality care to this valley. One of the things that kind of bugs me a little bit the most is when I see a patient and I'll see him for whatever, a shoulder or a hip or whatever it is, and then I see their other joint was replaced, and they go down to whether it's somewhere in the valley, Cedars, and yada yada, and they get their joint replaced by another surgeon. And what ends up happening, a lot of you patients don't know this, but patients that go down below and they get their orthopedic care, if you end up with a problem like an infection or whatever, where are you going to come? You're going to come to either Palmdale or Antelope Valley Hospital. You're not going to go down to Cedars for your infection if it's like really bad. So they end up calling us for these problems, and a lot of times we take care of these problems. And a lot of patients say, "Oh man, I didn't know about you," or whatever the excuse may be, or they didn't have the confidence in the Antelope Valley. So when I moved here in 2005, this valley didn't really have a lot of great reputation, at least with the orthopedic care, and that's one of the things that I wanted to change in coming here. So a lot of you know me for, the hip guy, and I've done a lot of hip replacements. So back in 2007, I was still doing the posterior approach, and if you were to go to any emergency room in this country, anyone, and you were to poll the emergency room doctors and ask them, how many hip dislocations do you get in your emergency room? They would all say, oh my gosh, we get 4 or 5 a day. And even in the best of hands, the best surgeons in the world that do the posterior approach, I think that we lost the mic, no, I said that. The posterior approach, people still get dislocations, and they can happen acutely, immediately after surgery, or they can happen years down the line. So that's one of the reasons I wanted to do the anterior approach, because in my opinion, and you know, the other posterior approach surgeons will argue this, but we feel that they do better, quicker, and in the 15 years of doing the anterior approach, I've not had one dislocation, not one. So it just goes to show that the people, in my opinion, they just do better. So we started doing the anterior approach. Now the anterior approach requires a special table. And that table at the time, it's called the HANA table, is about $175,000. So after taking this course down in Santa Monica by this very famous surgeon who used to practice in Santa Monica, who popularized this approach, I go to the CEO of the hospital, I'm like, Ed, I need a table. He's like, what do you need this table for? I'm like, I want to start doing this approach. And he's like, okay. And within a month, I had the table. So he believed in me, and then we started doing this approach, and it was you know, no looking back. I mean, it was just awesome. Patients do awesome, it's a quicker recovery. And granted, when I first started doing this surgery, you know, 2 hours, now we're doing it in, you know, 45 to 50 minutes, so less than half the time. So I want to take a quick poll. So the other thing I want to say is, a lot of you patients here are, you came for your one joint, whether it's a knee or a hip or a shoulder, and then we never see you again. Some people, you know, that's the beauty of orthopedics, right? It's the gift that keeps on giving, right? You only have one gallbladder, you only have one, appendix, you know, but with orthopedics, you got a lot of joints. So you keep coming back, and some of you in the room, I know I've replaced 1, 2, 3, maybe 4. So what I'd like to do now, just quickly, for those of you that have just one, it doesn't necessarily need to be by me, one joint replacement, please stand up. Just one. Okay, that's about 30% of the room. How about 2 joints? Wow. That's great. 3 joints. Wow. Wow. 4 joints? Wow. That's amazing. That is amazing. So that just goes to show that when you do good work and you take care of patients, they will come back. I know we have billboards and blah, 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 blah. But we don't really need to advertise because you guys are our advertisement. When you take care of a patient, whether it's grandpa, grandma, or their children, they will speak volumes if you take good care of them. And they will refer patients, and that's how we have grown as a practice. And I want to thank you all for coming today. And hopefully you guys will continue to refer your family and your friends to our office for any orthopedic care. Thank you.